Good afternoon, everyone. So let us now proceed with the part two of our discussion in the nursing informatics model. So let's have a recap of what we have discussed in the part one of our topic six on the nursing informatics model. Last time we have discussed the relationship of the nursing and knowledge, and we have identified six on its association and relationship with the nursing and knowledge. We have identified nurses as knowledge workers, as what we have discussed last time, that this is related to the acquisition of the knowledge, skills, and attitude pertaining to how nurses become independent in their practice and utilize this generated information and consider knowledge as a product. Number two, we have identified nurses as knowledge acquirers. This is eventually uh, considered how nurses maximize available resources, and this is very evident of being efficient, okay, in storing and capturing knowledge to be utilized in the institution. They have also emphasized that nurses are knowledge users because in this consideration, it covered the broader scope because it may be beneficial to individuals or groups or the organization which are considered viable, sustainable, and may have a direction that is significantly valuable if it is relevant, useful. Okay. Next, we have considered also nurses as knowledge engineers, the innovative skills and the involvement when it comes to planning, organizing, uh, directing, and evaluating on the use of the technology in the institution. It entails also on their involvement when it comes from the time that when it is planned, designed, when it is developed, and it is being used by the institution, the of the using or maximizing these resources, and they have considered themselves as the one uh, who are involved from the start up to the end of the process. We have considered also nurses as knowledge managers because this considered nurses as maximizing the manpower when it comes to the collective expertise. So the collaborative efforts on how to use nursing informatics as part of the process of the establishment. Number six, we have considered knowledge developers or generators because nurses have used the evolving knowledge as to become visionary. Okay. Visionary whenever there are uh, trends. Okay. There are trends and there are upgrading of the use of technology through the improvement and attainment of excellence of that institution. We have also discussed about the nursing informatics model and its relationship to the different key areas, and we have defined healthcare system as wherein the implementation of the the system, which covers not just only locally, but it starts from our setting, from the family up to the global level. And we have defined the healthcare system that starts with the community to the national level with Department of Health, the healthcare system that could be in the World Health Organization, which will which the core is mainly the use of the informatics. Okay, and we have mentioned the various coverage and sciences that covered informatics, and the areas that had been identified is education, practice, research, and administration. We have mentioned in the education on how it introduced the healthcare system using nursing informatics in preparing them for the expected competencies in the acquisition of the skills, knowledge, and attitude. When it comes to practice, The acquired skills, knowledge, and attitude are now being used even on the entry level and in the skills development. In research, the nursing informatics model are useful in the healthcare system with the significant findings that will provide solutions on problems that may be encountered by units or the establishment or organization. And when it comes to the administration, this entails the use of the informatics model in the healthcare system through organizational level and extending to the community level. We have identified also if we have the healthcare system and we have the areas, we have to integrate the use of the in nursing informatics model so that it may translate the data into information, into knowledge, soon as wisdom, and it will benefit the community for utilization. So we have identified information science. We have identified information science, which is the use of the technology in the processing of information. So it's all about the storage, processing, protection of the data is related to the information science. And the computer science is on the how nurses basically use the uh, skills literacy and basic knowledge in the processing of information using software and the hardware. Then the nursing science is the integration of the applied concepts in nursing. And to sum it up rather, this considers the what we call nursing informatics. When we combine the nursing informatics, the healthcare system, and the areas of nursing, then these are nursing informatics model, which may help to process the data, information, and transform it to knowledge. That's why if data is being processed to information, it becomes relevant, useful. Okay. And this could be more useful if this information will be translated to what? Will be translated into uh, convenience, into efficiency. So that translates information into knowledge. So now let's proceed with the topic for today. The topic for today, when it comes to the learning outcomes, is pertaining to the five key specialty areas. So, nursing informatics may have the five key specialty areas. And actually, this covered all of these key specialty areas could be under biomedical informatics. If we say biomedical informatics is the branch of health informatics data that uses data and helps clinician, researchers, scientists improve human health and provide healthcare. So we are getting towards the direction of improving healthcare and improving human health at the same time. So the system and the people involved are mainly the one of the primary purpose of the coverage of the biomedical informatics. Actually, biomedical informatics is an evolving discipline, and this has grown along with advances in biomedicine, which applies the principles of the natural science. Especially, this is a combination probably of biology, biochemistry, medicine, and healthcare. And with the integration of the informatics and technology, it integrates on how it's processed accordingly through the use of the computers and information technology. Nowadays, we are talking about artificial intelligence, and artificial intelligence is now a trend uh, concept in the biotechnology industry. And sooner or later, we may appreciate what does it mean. So let's proceed with the specialty areas. The five key specialty areas covers clinical informatics, consumer health informatics, three, educational informatics, fourth, public health informatics, and fifth, research in nursing informatics. Let us now see the picture of the how the biomedical informatics is relevant to what I have mentioned when it comes to the key areas. I have mentioned about biomedical informatics is the branch of health informatics that uses data to clinicians, researchers, and scientists. So meaning this expertise combined to improve, okay, to improve with the purpose of human health and providing healthcare. The biomedical informatics from this expertise may may consider the methods, techniques, and theories. So what we mean by methods, techniques, and theories? Those concepts, those learned concepts that may possibly direct improvement of the healthcare and human health could be combined, okay, could be reviewed, okay, and could be lead to the meta-analysis that may uh, associate these concepts with each other so that it may process and direct its concept towards health informatics. Actually, when we talk about bioinformatics, bioinformatics from this diagram or from this framework, it considers the focus on the cellular and molecular. So more definitive, more how the bioinformatics will uh, give us information on the extent that the human physiologic response, including the cells as the basic unit, may correlate with our response to a certain phenomena. Example, uh, how the body respond to vaccines, how the body respond to drugs, how the body will be immunocompromised with a certain therapy. This is because of the response of the cells. So this is coverage by the bioinformatics on how the cells will respond in connection with the physiologic functions of human. So cellular level, that's bioinformatics. When we talk about clinical informatics, the clinical informatics are more on the individual. So that includes the person, okay, the person himself or herself. So when it comes to the clinical informatics, it each our approach with our client is patient centered, right? And we treat patients with individual and peculiar needs. Clinical informatics comes in when you use clinical decision making that is um, possibly common with other patients, but our approach is more on patient centered. If we say patient centered, it may focus on individualized care. Each patient may have different profile. Each patient may have different medical history. Each patient may have different response to drug, and each patient may have what you call this may have different background when it comes to lifestyle. Now, we took clinical informatics as for the individual with the internal and external factors. So what's the difference? Let us now differentiate bioinformatics and clinical informatics. Bioinformatics is more deeper, cellular level, which could be common to everyone, cells, okay, to everyone. But for the clinical informatics, this could the theories and the theories and concepts that could be presented may be common, okay, may be common and clustered with each other. Example, one intensive care unit could we could admit all patients with stroke, okay, all patients with stroke. So what's common? Each four, for example, four patients are admitted in the stroke unit. All of them stroke. What system is involved? Definitely the central nervous system, or rather the nervous system. So if it is common with the systemic involvement, it may have different response accordingly. Each may have different affectation. If we're considering, for example, all of them are affecting the brain, but not all of their conditions affect the same part of the brain. And considering that analysis, since each individual may have different medical history and with different possibly hospitalization history or drug history, then it may also have individualized approach. And that individualized approach is what we call clinical informatics. Okay? So that's why we heard about when we have heard about clinical trials, the clinical trials, for example, a drug can be tested or can be given for clinical trial to an individual, and he or she will be subject for monitoring. The response, the adverse effect, okay, the adverse effect is an evidence by which response of the physiologic function. That's bioinformatics. For the individuals who have felt the adverse effects and observe and gather data accordingly with all of the adverse effects of the drugs, that's clinical informatics. So that's the difference. Let us now proceed with the public health informatics. For public health informatics, the scope of the scope and coverage of the informatics are more broad. So this could be more on community level. From the term itself, public health informatics, this may consider population groups, community, families, locality. Okay. For public health informatics, uh, this may entail on a broader scope by which it may affect more more number of individuals as one community. That's why when we use the concepts of epidemic, pandemic, this may also consider numbers, okay, and the extent of its affectation when it comes to geographical uh, areas are being considered. And that's why this in the public in health informatics, it is the use of the technology to gather the data and eventually translate it in information so that it could lead to the possibility to cluster it on a certain classification and transform it into information how and on how it could have measures for prevention, for curative, and for rehabilitative phase of healthcare delivery. So that's for the public health informatics. How about consumer health informatics? For consumer health informatics, this is the focus is more on specific area or groups. It could be, for example, consumer health informatics education, okay? Consumer health informatics for hospital, consumer health informatics on a nursing home. So from the term itself, consumer, we have it is focused mainly on a specialized group, on identified group that may benefit the technology, but that may benefit the skills of nurses in the use of technology as nursing informatics. So most of the consideration when it comes to consumer health informatics are based from how health information, okay, the focus is on how health information can be disseminated efficiently. Just like for education in schools, we have different ways. We have platforms, we have aims on how to process transactions, on how to receive information. We have the virtual learning environment as a platform by which we considered how the instruction are being delivered using the technology and the platform. So for the hospital, we have the hospital information system, which the focus is the hospital operations specifically, and the beneficiaries when it comes to this process are the patients, which they may experience satisfaction and convenience when it comes to this integration of concept. So if it is nursing home, it may help or have efficient coordination with the administrators and with the staff accordingly on how the nursing home are being operated when it comes to the information dissemination. So these areas that I have mentioned, bioinformatics are on the cellular and molecular level. Clinical informatics are more on focus on individuals. Public health informatics are focused on population. Consumer health informatics are focused on health information. If you will notice, when it comes to research, from biomedical down to applied research practice, basic research focus on the use of science. And we all know that in basic science, we identify the problem, we gather data, we process it, and we turn it into a solution or a conclusion. The applied research practice may focus on the utilization. What do you mean by utilization? The conclusion that turn into recommendations, and these recommendations will be used by the beneficiaries of the target beneficiaries so that it may improve, okay, the system or health. So if you have started the basic research and you have the findings and recommendations, okay, if it could be published, it could be disseminated, but much better if the recommendations can be cascaded and translated into a project, initiative, policies. So this is more evident as applied research and practice because it may consider the change in the system, it may evidently improve the system, it may basically enhance policies, existing policies. So these are more measurable. Okay. So what had been indicated below when it comes to the health dissemination information, in the health dissemination information, we have the e-health and we have the m-health. The e-health is more focused on the health tools and services. So what do you mean by health tools and services? From the term itself, electronic health. The electronic health is the use of the health tools on how, for example, in the hospital information system, we are using the electronic health records or EHR. We have a platform how to process the data, the patient's data accordingly is using the hospital information system, and how the process by which the concerned department may access the information is through this e-health. Okay, so it's more on the institutional. So when we talk about the m-health or mobile health devices, there are some applications that can be uploaded or downloaded accordingly that can be accessed even outside the institution. This could be more beneficial, more beneficial to the public. However, it could be also institutional that could be peculiar to the services of the organization, or it could be on the national level, just like for the Department of Health, wherein we could download the application and eventually will be useful for health dissemination information. Okay, so this is the framework of the biomedical informatics. So let's start with the clinical informatics. We have mentioned about that the clinical informatics is focused on the individuals. And if you will notice in the clinical informatics, we have the clinical care, the information technology, and the health system. Nowadays, we're talking about the universal healthcare, and we all know that the universal healthcare is health for all. And when it comes to the individualized care, the use of the information technology and the using the concepts of health for all for the universal healthcare may benefit who? Who will benefit? Obviously, the beneficiaries are the patients, well or sick individuals. Because when it comes to clinical informatics, we're talking about clinical care. From the term itself, clinical care, and when we talk about clinical decision making, it's evidence-based practice. And when it comes to the evidence-based practice, these are uh, care management that can be done individually, okay, with individual patients, that are what? That are based on theories, that are evident, and that are based from researches. And we all know for a fact that the clinical informatics are judges that draw directly on the clinical backgrounds as well as organizational skills and informatics knowledge. So what does it mean? Um, for example, if the hospital is tertiary hospital, and let's talk about the informatics knowledge. So for clinical informatics, if we talk about general tertiary hospital, okay, MCU FDTMF hospital is general general and training hospital. So these three areas may have different approaches. If we talk about if we talk about tertiary hospital, this DOH may classify our hospital as with higher expected level of services. It may not other than the bed capacity, but eventually it may offer expected or higher level of services when it comes to the laboratory, when it comes to treatment facilities, when it comes to extensive rehabilitative services and facilities. So more extensive services, or it could cater services that are expected to the health needs and demands. And if we talk about general, that's the tertiary and general, that's different from specialty hospital. The specialty hospital may only cover specific areas such as mental, okay, National Center for Mental Health, San Lazaro Hospital for Communicable Disease. But for NCU Hospital, we have general hospital. Tertiary, extensive services. General, it may cater majority of the expected services, medical, surgical, uh, medical, surgical, obstetrical. So those are the expected services that could have extensive. Now, if we talk about clinical informatics, it covers eventually on the obstetrical aspect or services, then this may focus on the individualized care of patients who are expected to receive, okay, to receive uh, treatment, services, assistance when it comes to gynecological or obstetrical management. So for example, in the hospital information system, the system can be designed in general for all patients. But if we talk about the care management for obstetric, we may have different approach because there are some areas in the obstetric care that could be more focused on the how we could be more holistic and how could we be more efficient when it comes to the expected services that the patient may achieve when it comes to optimum health as obstetric client. So that is basically clinical informatics. So it is individualized. And in clinical informatics, we may consider that nurses when it comes to roles are expected to maximize their professional roles. If for example, since we have the individualized approach in clinical informatics, it is expected that for a nurse who will be assigned uh, in the obstetric ward has the expected competencies as well in obstetric care management. And if we will integrate the nursing informatics, this may consider to have the professional role in focus on the needs assessment, the system selection when it comes to the nursing informatics, and the implementation as well. So, for example, if we have the platform, the hospital information system that are being used in the obstetric ward, and basic information that are very necessary for obstetric client must be what? Must take part when it comes to the input as expected by the obstetrician and the health team members. On, for example, when they need to access the obstetrical history, it is expected for the nurse to have the input and knowledge as well when it comes to the information needed by the health team. If the nutritionist may need specialized diet for that obstetric client because of comorbidity, then the nutritionist in coordination with the nurse and with the health team can have a holistic management through the use of the technology because of the access of information using the platform, which is the hospital information system. So individualized, that's clinical informatics. So let us now proceed with the number two. The number two is all about the consumer health informatics. In the consumer health informatics, this entails on how the organization will effectively and efficiently disseminate health information. A while ago, we have identified the use of e-health and m-health. Okay, e-health is electronic health. M-health is mobile health. Now, we have mentioned that when it comes to electronic health, it is based from the uh, resources related to the information of the patients, the hospitals, records that are centralized accordingly with the platform of the hospital information system. While extensive services could be accessed outside the hospital, if there are some applications that can be downloaded for an extensive services if the stakeholders, the patients wish to access accordingly. So on this aspect, if you will notice that we have the use of the health tools more on the e-health and professional health information system. Okay, in the professional health information system, it includes the following. We have the electronic health records. Okay, as what I have mentioned, the electronic health records are the centralized information that had been processed in the hospital that serve us for the storage, for the access, for the protection, and at the same time for process whenever needed. Other than that, we have the clinical report forms. The clinical report forms are those that may consider the access accordingly on the patient history, medical history, hospitalization, and other previous physical examination findings of the client. We have also identified accordingly on how on what records have been identified when it comes to the progress hospitalization report. The integrated care pathway or the hospital progress report entails on from the time that the client had been admitted in the hospital until the client had been discharged. So the process to track, okay, the process to track on how the client accordingly had been attended in the hospital from the start of the care management up to the end of the care management, then this will can be accessed accordingly on the integrated care pathway. The other one is we have the clinical decision support system. I know that this has been your topic now in the laboratory, the clinical decision support system, wherein it will help the health team members, okay, to eventually have the access of the information that could be useful for the care management of the client. Now, when it comes to this is more on the professional health information system. So number one, electronic health records are the process centralized medical patient records that are processed by the institution. The clinical report forms are the ones that have been identified accordingly uh, when it comes to the physical examination findings, diagnostic results, previous history, patient history. When we talk about the integrated care pathways, these are the records that are based from what? These are the records that are based from the hospitalization progress report from the time of the admission up to the time that the client has been discharged. The clinical decision support system is on how the health team members process the care management of the client, which which in the professional health information systems, it gives us the idea of the feedback system and healthcare process modeling. If you say healthcare process modeling, this will gives us the picture or the structure on how this information had been processed as one security tool. So what do you mean by security tools? On how this will secure the confidentiality, will secure protection of the hospital when it comes to the patient's record. Now, at the center, we have the concept translator, standard document architecture, standard communication architecture. So if we say architecture, it is on how the system, on how the nursing informatics or the health informatics are being conceptualized according to the needs of the hospital. As what I've told you, we have primary hospital, secondary hospital, tertiary hospital. So expect for a tertiary hospital to have higher level of services. So what could be the architecture? The architecture could be more broader. The architecture expected to have higher level of expectations. So the concept of the access of the information could be more that could consider more individual access, unlike for primary hospital who may have less number of manpower. Now let us now proceed with consumer health informatics application. For consumer health informatics application, this is on how the hospital or any facility will connect the services to the consumer, and they are the stakeholders. Okay? On the stakeholders, we may have personal health record. So actually, if the patient wish to access her personal health record, it the patient can request to the hospital, and if the hospital will give the access rights to the client, the patient will not anymore visit the hospital. Through the consumer health informatics application, the patient can just access as based from the agreement of confidentiality and protection. Another is if the client had been discharged, that is for monitoring system. If the client had been discharged, then if the hospital wished to monitor the status of the client for the first week after the discharge, the monitoring system through for example it's mobile, through the mobile application can just communicate with the platform that are being used by the hospital and send the information accordingly when it comes to results. Example, the client had been identified to monitor the blood sugar, and there could be part of the platform of the hospital with the access to the doctor to have the direct information to enter those information and will send to the respective doctors for attending physician for the as recipient of the information for monitoring purposes. Other than its personal mobile application, so this is what I've told you, which considers the convenience and the accessibility on the use of these applications, which it could be more efficient, and it could be more accessible to the fast pace. It could be fast pacing. Fast pacing meaning it could be accessed easily. So that's why both satisfaction are given. Services are extended by the hospital to the client even outside the hospital. So there is a continuity of care. So there is a process of feedback from hospital, feedback from the patients, even not on a face-to-face contact. Through the use of the technology, they could exchange information. So that's how naman we consider the patient work framework. The patient work framework will set mindset to the patient on how he or she will utilize the use of the technology in connection with as recipient of the services of the hospital. So I hope you understand on the concept. So actually, the consumer health information are more seemingly uh, concerned with the stakeholders, with the patients, okay, on how the establishment, on how the health facility, on how the hospital will still be connected to the consumer even outside the establishment. And this could lead to health promotion, disease prevention, self-management, and patient-centered care, because this is, as what I mentioned, the key term is about continuity of care. The care management may not just end up when the client will leave the portals of the institution, but eventually communication could be still continued accordingly through the use of this technology, and even through a mobile application, which in the consumer health information, there could be informations that through the feedback system may aid in the self-management of health and illness. Why? Because, for example, if the consumer can still have access on the health education materials of the hospital, then if ever he or she may need access on the information to manage. For example, the nurse will emphasize that whenever you feel headache after taking this certain drug, these are the measures that you must do. Okay? It could be verbalized as part of the discharge teaching. But eventually, this could not be all of these tips, all of these teachings can be retained 100% in the mind or in the subconscious mind of your patient. So if the client eventually has a question and experience headache, the nurse is not anymore with him. Okay? How about if the nurse cannot be accessible, or is not accessible, or can't be contact accordingly for the questions? And even if the patient has the privilege to access for this basic discharge information, so at least the client can just access that if search that the client experienced headache upon taking this drug, it already enumerated there the measures on how he or she may have self-management. So yun, that's in the self-management. So this is the importance of the consumer health informatics. In the consumer health informatics, these are the basic services that are being offered nowadays, most especially in our situation now in the public health emergency. We have the telemedicine, we have the telehealth, and we have the telemonitoring. Okay. What is telemedicine? The telemedicine is the delivery of services at a distance. For example, when the patient is at home, there's certain limitations when it comes to physical distancing. There's certain limitations to public transport due to the declared uh, community quarantine. For example, certain limitation and restrictions on age, because senior citizens are not allowed to go out of their homes and make the consultations in the hospital. Telemedicine could be one of the measures to deliver the services at a distance. So this could be done through the video conference. Okay. The prescription could be sent electronically, and it could be accessed accordingly. So the conversation can be done accordingly through a video conference, and the client may receive all the necessary uh, instructions, prescriptions electronically. So that's telemedicine. While the telehealth is more on how the client will become more independent. Okay? As what I've told you a while ago, if the client will aid for self-management, if the client will aid for decisions, if she or he doesn't have any access to the medical personnel for attention at a time that he or she may need it, so the client may just have a basic portal that may be interactive with educational materials. What do you mean by interactive? with educational materials. So there are already stored educational materials that can be accessed to the hospital portal. For example, as what I've told you in the telehealth, uh, it could be on the process of the stored information that can be accessed when it comes to first aid. Okay, so this is telehealth. Okay, even though there are no direct face-to-face interactions, but the client can answer questions as an extended services of the hospital through that access right in the portal of the hospital information system. How about for telemonitoring? For the telemonitoring, this delivers patients' data to clinician. Okay, for example, the client undergone the chest X-ray. Okay, and the chest X-ray is needed by the pulmonologist. So both of them may have constraints and restrictions to proceed to the hospital, but the pulmonologists already need the access for the results. So the telemonitoring can be done wherein from the hospital, okay, from the hospital, it may reach to the physician. The results may reach to the physician with the specific results, and with the initial and primary reading, initial and reading of the pulmonologist based from the results, in coordination possibly with the expert radiologic specialists or doctors, then the interpretation could be done even electronically. So that's what you call telemonitoring. So other than that is, for example, the client undergone laboratory examinations, then this may help specifically the client to access with the results, but primarily from the doctor and doctor to the patients, which could be useful naman when it comes to telemedicine. Okay? So that is in relation to the three. So we have the telemedicine, we have the telehealth, and we have the telemonitoring. Now, in the consumer health informatics, you will see that this is on the perspective or the setup of education. Okay, so education dissemination. So for example, the hospital offered health education portal for the patients, well and sick individuals. It could be inpatient or outpatient. On the health education website, we have health web health forum, patient portal, and fitness tracker application. So these are examples of the use of the consumer health informatics. Number one, when it comes to the health education website, the client may just visit the portal or the website, the web source of the hospital, and all of the basic health information based from the services that are expected with that specific hospital could be accessed. The web health forum could be organizational, could be individualized. This is on how the portal or the platform can be used to have interactive discussions, even not on a face-to-face meeting. The patient portal is based from how the records can be accessed accordingly through the use of the consumer health informatics. And when it comes to the fitness tracker application, this is probably another services that can be done for the wellness, okay, of the patient. Other than fitness tracker, this could be more on the monitoring when it comes to the specialized conditions that may need daily, okay, tracking of results. So these are examples of the consumer health informatics as mentioned. Okay. So before we proceed with the third on the educational informatics, so I may end up to this part two of our video discussion, and I will continue with the part three on the next three key specialty areas on my third video discussion of the five key specialty areas of nursing informatics. Thank you very much.